This is Dr. Corey Maas on Looking Your Best. I wanted to talk today about some exciting news. That's the announcement of the release or the FDA approval of a new injectable filler product from Allergan, the company that makes Botox, called Juvederm Volbella. You'll be hearing a lot about Volbella because it's one of the newly targeted indication products that are out there. In other words, we're going away from the time when we had a whole handful of fillers and it was use them everywhere. It didn't make any difference where you used them. And now we're targeting specific indications like we have with Restylane Silk, and Volbella is specifically targeted for the lips. Volbella studies that were done and conducted here in the United States in their pivotal trial showed excellent results, and in fact at 3, 6, and even 9 months after the treatment, subjects that were rating their lip enhancement goals rated the goals as being achieved in the mid to high 90s all the way out to 9 months, which is unique amongst the filler products for lip indications. If we compare those to some of the other studies that have been done as open label studies, we see that the products, the other hyaluronans, typically degrade and those ratings go down into the 70s, 60s, and even 50s by 9 months. So now we have a longer acting product. The other interesting thing about Volbella, the newly released HA filler for lip indications, is that it doesn't cause very much swelling, and that's because the concentration of HA is a little lower, while at the same time it gives very long duration. A few of the characteristics of this particular product that make it unique is that it's cross-linked with long and short chains of these sugars. And just to give you a little background without too much science, is the hyaluronans are sugar molecules that occur as structural components throughout the animal kingdom. It's in our skin, it's in our joints, and it's an important part of the structural nature of our skin and the dermis itself. So it's a very natural product, and what makes the products that we use in the syringe different is that there are cross-linking mechanisms, and in this case they take, again, the short chains and the long chains and let them all bind together, which makes the flow of the product much easier and also makes its what's called elastic modulus, or G prime, lower, meaning it's softer. So with Volbella, we'll see less swelling or water retention in the areas around the lips and eyes, giving less of a bee stung look around the lips, for example. We'll also see a softer result. And what's most interesting or exciting, in my opinion, about this study is that the average volume of ejection was less than 2 cc's to receive for the upper and lower lip to achieve an optimal result. This included a primary treatment, which ended up being about 1.6 ml, and a secondary treatment, which was much less. What's most exciting about this product, I think, is the volume of injection, which has a big impact on pricing and how we do the treatment. And in the Volbella study, the initial treatment, all these studies are conducted in a similar way. There's an initial treatment and then a touch-up treatment. With Volbella, the initial treatment to get to optimum correction of both the upper and lower lip, the volume used was 1.2 cc's, and the touch-up was less than 0.6, so total volume was less than 2 ml or 2 syringes of the product. Whereas when we look at the Juvederm study or the Restylane study that was done for the pivotal trial, those products required 2.5 or 2.2 cc's to get to that optimum correction. So what it looks like is we'll be able to use less volume to achieve a satisfactory result with better flow, softer feel. And so I think this really is a step in the right direction of adding more tools for us as surgeons and physicians to get optimum correction in the perioral area. There's data about fine lines with it. We're excited to be trying this for the little fine radial lines around the lips. There will certainly be some comparative studies, some of which we're conducting soon. But in any case, we have a really nice product that's being added to the portfolio of options that we have for each of our patients to get every area of the body treated, and the face in particular treated to the best outcome. We always want you looking your best. This is Dr. Maas. If you have any questions about Volbella, please don't hesitate to send me an email or use the dialog box on drmaas.com. and I'm happy to get those answers to you as quickly as possible. They can be done privately or publicly. You can share photos if you have specific questions, and as always, it's my pleasure to help you keep looking your best. This is Dr. Corey Maas.